Hello, everyone. My name is Asse Özgürer, and I'm a medical student in Turkey, and I'm in my last year. Today, I am going to present about the relationship between the fecal microbiota and neurological disease, and usage of the fecal microbiota transplantation in this certain disease. So, in this presentation, I aim to summarize the data on the role of the microbiota brain-gut axis in the pathogenesis of neurological disease, namely epilepsy, migraine, and Parkinson's. And this is going to be my slide flow. I will be talking about the microbiota brain-gut axis, fecal microbiota transplantation, and gut condition in this certain neurological disease, namely epilepsy, migraine, and Parkinson's. And I want to talk about some studies. So firstly, I want to briefly mention the microbiota brain-gut axis. We call it axis because it consists of bidirectional exchange between the central nervous system and our GI tract. So visceral feedback from our intestines to the spinal cord. It's carried out through our afferent spinal and sensory vagal nerves. And in this way, we can engage polysynapses entrances to the higher areas of the brain, such as hypothalamus and limbic forebrain. And not only mentioned about the neural pathway, we can also talk about the endocrine system and humoral cell involved in this communication. So fecal microbiota transplantation, I want to say, FDA, American Association, is considered human feces as drug. So right now we mainly use fecal microbiota transplantation to treat the persistent infection with some bacteria like Clostridium difficile. But the studies shows us that we can use in the future to treat the neurological disease. And I want to mention that the fecal microtransplantation in the persistent infection of the Clostridium difficile, there is a 90%, almost 90% cure rate. So it is promising that if we use fecal microbiota transplantation in this treat to neurological disease, we can get that cure rate, we believe. So gut dysbacteriosis is closely related to various intestinal and extra-intestinal disease. Fecal microbiota transplantation is a biological therapy that entails transferring the gut microbiota from healthy individual to patient in order to reconstruct the intestinal microflora in the later. So we can do, how does the fecal microbiota transplantation occur? So basically we take a fecal material from a healthy individual and dilute it and make a suspension with it and give it to an ill patient who has neuropsychiatric and neurological disorders. And we do it with various ways, but most common is colonoscopy. Most common way is a colonoscopy, but we can also use jejunoscopy and nasogastric tube as well. So in this picture, you can see our theory is basically based on this algorithm. The studies showed us if we take a fecal material from a healthy donor and transplant it into an ill patient who has neuropsychiatric and neurological disease, the study, we expect to see observe the ill patient's symptoms regress, and the gut microbiota of the patient approach to normal healthy microbiota. And it can occur for vice versa. If you take a fecal material from the ill patient and transplant it to a healthy individual, we expect to see neuropsychiatric behavior and neurologic symptoms. And we expect to see the gut microbiota is altered. So this is a brief summary. And in worldwide, we have over 65 million epilepsy patients, and half of them are, we don't know the cause, so we call it idiopathic, and 1/3 of them is drug resistant. So one research area is the potential role of the microbiota in drug resistant epilepsy. So in studies on microbiota, drug resistance epilepsy groups were either compared to drug responsive groups or to health controls. And in one study assessed the microbiota profile in the treatment resistant epilepsy patients versus treatment responsive patients, and found significant differences in the composition of gut microbiota. And the gut microbiota composition of drug responsive patients was similar to healthy controls. So, and since our diet can affect our gut microbiome, so another research area gaining attention is the relationship between the gut microbiota and ketogenic diet. And preclinical studies support the link between the ketogenic diet and epilepsy treatment. So, and I want to mention about the patient with inflammatory bowel disease are more susceptible to epilepsy. And a ketogenic diet is an effective treatment for patients with intractable epilepsy. Based on the clinical facts, the role of the microbiome and the gut-brain axis in epilepsy cannot be ignored. So there is some studies in other study design, in different study design, we always see the statistically significant change in the gut microbiota composition in the treatment-resistant and treatment-responsive patients and the healthy individuals. So I want to talk about migraine as well. The current evidence shows that the gut-brain axis may impact on migraine, despite the mechanism explaining this interaction is not entirely clear. So generally, this interaction seems to be influenced by multiple factors, such as inflammatory mediators, gut microbiota profile, we are interested in this, and neuropeptides and serotonin pathways, stress hormones, and nutritional substances. So migraine patients with long headache history and high headache frequency have a higher chance to be diagnosed with inflammatory bowel disease. So inflammatory bowel disease and migraine share some similarities and can alter gut microbiota composition, and thereby may affect the gut microbiota axis and inflammatory status. So it can be hypothesized that prescribing dietary approaches with beneficial effects on gut microbiota and gut-brain axis, including appropriate consumption of fiber per day, adhering to a low glycemic index diet, supplementation with vitamin D, omega-3 and probiotics as well, could lead to improvements in migraine-associated features. And in these studies, we treat patients with probiotics who has migraines, and we saw a significantly reduction in the mean frequency of migraine attacks, migraine severity, migraine duration, and the number of drugs taken per day. It's important because patients who has migraines use a lot of drugs and a lot of opioids as well, and these drugs has an adverse effects. So if we can manage the treat people with fecal microbiota transplantation, we can eliminate the drug use. So it will be good for the patients. And as we all know, Parkinson's disease is a most common neurodegenerative disorder, one of the most common ones, and it has motor and non-motor features. So the pathology is there is a abnormally fold A-synuclein protein. If the protein folded abnormally, it accumulates in the motor neuron axons and can cause a motor damage. And we can found in the central autonomous and enteric nervous system as well, this alpha-synuclein protein. So a large body of evidence showed the bidirectional interaction between the gut and the brain regarding asynuclein pathology. It was suggested that the GI tract may be responsible for the spread of Parkinson's disease, since inclusions of a synuclein may at first appear in the ENS. It's interesting, and only later they are transmitted to CNS. So, and I want to mention that there is evidence in one study coming from both clinical studies. There's a lot of, not one, that the leaky gut may cause asynuclein aggregation. So leaky gut is basically something that disturbs our intestinal lining and allows the toxins and the bacteria to pass that border. And patients with Parkinson's disease have significantly altered gut bacteria in relation to both its quality and quantity. A number of them present small intestinal bacteria overgrowth, which is responsible for malabsorption, bloating, as well as worsening of motor impairment, and may cause fluctuating response to treatment with levodopa. So it's bad for us because we mainly use levodopa for the treat the Parkinson's patient, and also it's promising that if we can change the microbiota condition, we can use levodopa and we can benefit from levodopa as well. So eradication of small intestinal bacteria overgrowth improved both motor and GI symptoms. And there is a study of Parkinson's disease model mice confirmed that the gut microbiota contributes to motor deficits and neuroinflammation, and suggested that the alteration in the human intestinal microbiome represents as a risk factor for Parkinson's disease. So in these studies, we also treat the Parkinson's patients with probiotics, and we saw some significantly improved constipation symptoms that we can expect because probiotics are changing our gut microbiota. But we also see there is an improved motor score and quality of life in the Parkinson's disease patients. So, as I say, when I first hear Dr. Stein and Dr. Bernard were talking about the gut as our second brain, I was very interested. And it is promising since there is a strong relationship between the gut microbiota and the CNS disorders, neurological and neuropsychiatric disorders. I believe that we can use the fecal microbiota transplantation with a high cure rate in these patients. So thank you for your patience, and this is my references as well. Thank you.